School districts in nearly every state are debating whether it is safe to return to in-person learning. The CDC is urging schools to open their doors again. Hundreds of districts turned to virtual learning to protect students, faculty, and staff from the spread of COVID-19. However, in the state of Rhode Island, schools remained open well before the CDC deemed it safe. Despite the backlash, Governor Raimondo fought to keep kids in school. The question now, whether or not the governor was successful in keeping kids safe and providing a quality education. Joining me now is Susan Dominus. Susan is a staff writer for the New York Times Magazine. Hi, Susan. Welcome. Great to have you with us. So, is it time for the final verdict for the state of Rhode Island? Was the state successful in keeping schools open, and did it ultimately benefit the students? And did many people get sick?
A lot of people in Rhode Island did get sick, certainly. It's, whether that's linked to the schools or not is a different question. The schools were open in September, 5 days a week for elementary schools. What they do say, the health department there, is that the spread among students was very limited. The students were able to go every day, see their teachers, certainly in the elementary school, see their friends, have those relationships, have access to, free lunch. They saw vaccination rates recover after the previous spring when they had plummeted. There are all sorts of public health goods that come from kids being in school, and I think those were definitely borne out in Rhode Island.
So Rhode Island educational conditions before COVID were not great. How did the educational crisis in Rhode Island play into the governor's decision to keep schools open through the pandemic?
Well, certainly, I can't speak for Rhode Island in general, but Providence was deemed to be in such bad shape that it actually, pre-COVID, was in state takeover. Its buildings were crumbling. The kids were nowhere near grade level. But what that meant, I think, is that when the Providence Teachers Union was at the table or involved in discussions, they had good reason to kind of make a good faith showing of coming to school and teaching the kids. And so, the relationship between the union there and the governor was maybe a little bit unusual. And I think it worked in favor of the teachers showing up for school back in September, when really a lot of people felt like there were many unknowns.
And how do you think the governor weighed the risk of returning to school versus the risk of leaving children behind if the state remained in remote learning?
I asked her about that, and she was really interesting. She said, we know that there is 100% risk of poor outcomes to kids who don't go to school in terms of lost learning, emotional health, obesity, lower vaccination rates. That's 100% that we can see we're going to have a really big problem with that. Maybe the schools are safe. Let's try it. She was weighing one certainty, which was 100% certainty that things would go badly for kids if they were not in school, versus an unknown probability of a safety risk in the schools. And she decided they could try to open. And then if things proved problematic, as she saw it, they were tracking the numbers incredibly closely, they could always, close it down. But why not try? That's how she saw it.
But of course, she had to work with both teachers' unions and parents. How did she navigate those conversations? I mean, because we have seen teachers in other states really resist, going back to in-person learning before they felt it was safe. How did she navigate that?
My sense is that she started early, for one thing. She didn't sort of wait until August to say, I think we can pull this off. She started her messaging in June. In June, she had the education commissioner and the health commissioner show up with her at almost every single, near weekly, address to the public that she did, and talked about all the ways they were going to try to open the schools, the mitigation measures. She was extremely resourceful about bringing in experts who could educate educators about ventilation precautions they could take, such as something as simple as opening the window 4 inches or putting in a box fan. While it was warm enough, experts deemed that safe enough, even in not great buildings with not great quality. She also brought the unions in really early, and I think a couple of union leaders said to me, we brought our concerns about safety, what we felt we needed, and she addressed them. So she started early. The planning was aggressive. There was a huge public education campaign. She herself did Facebook Lives regularly just about school safety and why they thought they could open the school safely. So it was really a priority for her in a way that I don't think it was for certainly any other Democratic governor. She really committed to this issue. It was really important to her.
Are there, lessons learned here that could replicate themselves in other states? Because again, as I was mentioning, we've seen teachers across the country really resist going back to school in certain areas. So how did the decision to keep the schools open in Rhode Island impact the teachers ultimately? Like, from their perspective, at this point, was it a success? Are they still happy with the decision?
Success is a complicated word. I think it was a really stressful year for the teachers. And although they were certainly worried about safety, they were also really worried about the staffing issues that were a problem because so many people were carefully quarantining. So there was a lot of scrambling, a lot of covering, there was a lot of improvising. And I think that really took a toll on teachers and was pretty exhausting. I will say that, many teachers told me that in the beginning of the year, they had a lot of concerns about their safety, and that by January, it's not that they felt there was no concern, but it wasn't a daily stressor for them necessarily, that they weren't seeing cases of one kid getting sick and then lots of kids getting sick in the classroom. Or, it no longer felt like, well, surely if a child tests positive in my class, I too will test positive. And there's also been so much research suggesting that schools can be safe, that transmission in schools can be very, very limited if there's social distancing, if there's masking, if there's, careful ventilation, if there's people who are really paying attention to these safety measures. It seems doable. It does seem doable. I think they feel like it was doable. It wasn't easy. It was stressful. At times it even felt kind of absurd in terms of the measures they had to go to make things work. But they showed up and they did it. And these kids got to go to school, which we all now know, I think, all too well, how important that is.
Yes, and I'm sure the parents were also thrilled about that as well. All right, well, Susan Dominus, thank you so much for joining us. We really appreciate it.
Thanks for having me. Appreciate it.